We are now having this IDF Europe Youth Leadership Camp, which is a camp of about 24 participants from all over Europe. They are all living with type 1 diabetes, and the idea is really for them to exchange their experience, understand how health systems are very different across Europe. They have different access to insulin pumps, to CGMs, to treatment, etc. So for us it's important that they understand that access is different across Europe, and it's also a leadership program where we try to give them the leadership skills that they would need later to work, with their member association in the country, but also to talk to policymakers and make sure that the voice of people living with diabetes is heard. So the youth program is one of the IDF Europe core program. It has been going on nearly since the inception of the organization, and we really feel strongly about making sure that the voice of the youth is incorporated in everything we do. So being the research project we are engaged in, being the advocacy work we are doing, the publication we are working, most of the time we try to have the voice of the youth engaged in everything we do. And so currently we have about 120 youth in our network, and this is an amazing platform for them to build on other projects, and also for us to engage with policymakers and on various projects. I think the European Union would say that they are doing a lot, but they focus exclusively or nearly exclusively on primary prevention. So they say you have to have more attention to the diet, to do more physical activity, and that's the kind of best practices they tell member states that's what you have to implement in country, and that's where they stop. Also because we know that health is not a competence of the EU, so they find a little bit difficult to engage more. But we also know that there are currently 32 million people living with diabetes in the EU, so it's no longer the case of preventing the disease. People are living with it. And we also know that even if you try to prevent, there are quite a number of risk factors that you cannot modify. So yes, you can modify your diet, you can change your physical activity, but you cannot change your family history, you cannot change your age. So some people will develop diabetes, whatever. So it's very important to make sure that these get the appropriate treatment and access to what they need. So currently the EU is very much focusing on NCDs, so non-communicable diseases, and on this primary prevention. What we really would like them to do is to understand that diabetes is a very complex disease and that it doesn't stop, with primary prevention. But if you do not manage the condition properly, then you have so many diabetes-related complications that occur. You reduce by about 10 years the life expectancy, and you are much more likely to develop heart disease, kidney disease. Diabetes is one of the leading causes of blindness, amputation. It's a very severe disease if not well managed. So we really would like the EU to make sure that they give recommendations to the member states to implement good national diabetes plans that include the prevention, the primary prevention part, but also the secondary prevention part. This is critically important. And we also see that if you look at diabetes, if healthcare systems are well equipped to deal with diabetes, so looking at the prevention, primary prevention, but also looking at the various steps of the management, then this healthcare system would be well equipped to deal with nearly all chronic diseases. So we tend to say that diabetes is a mark of resilience of healthcare systems, and if a healthcare system is well equipped for diabetes, then for most of the NCDs, it's a healthcare system that will be functional. Usually, okay, so you have various types of diabetes. So you have the type 1, which is the autoimmune disease, and which usually occurs when in children and adolescents and young adults. But we see that it's getting later. Some of people living with type 1 diabetes are diagnosed later. For people living with type 2, it used to be around 50, and obviously the more you age, the more you are likely to get diabetes. But we also see that now it's getting earlier and earlier. There are quite a number of people living with type 2 that are now diagnosed around their 40s, but unfortunately we see some countries where children are getting type 2 diabetes, and that's very much linked, unfortunately, to the fact that they don't move enough, they don't have access to the proper diet, and this is not always their fault. It's very often, the social economic level in which they live, and also the push of some food industry. So yes, there is we see that the age of diagnosis of type 2 diabetes is getting lower than it used to be, which is a huge problem, because the earlier you are diagnosed, not the earlier, if you are diagnosed at an early age, you have much more risk of developing these complications that I was mentioning earlier, that would really affect their quality of life on the long term. And you were saying about the economy that you are also covering. It's a huge cost for healthcare systems. We know that about 75% of healthcare budgets for diabetes are related to diabetes preventable complications. I believe, first of all, it's to bring in new perspectives. The world is evolving very quickly now, so it's important to follow, the new trends. And in terms of diabetes, there are a lot of innovations, more specifically in the technology, and they are so quick to understand everything, to see, what beneficial to them, etc. So we need to hear from them, and we need to learn from them. We also call them change makers, because these are the ones who come up with new ideas and are able to provide another type of perspective. So I think it's very important to work, with young people, but also, in collaboration with the more traditional diabetes association, who are probably also have a huge experience of how you get out to the community. So it's important to have the two, but yes, giving the voice to the young people is critically important.